Let's look then at the maxilla, our next bone of the face. By the way, both the mandible and the maxilla are single bones. There is only one of them. The maxilla then, from an anterior view, we can identify several of its landmarks. The first to notice are the upward growths from the main portion of the bone towards the forehead. The forehead itself is made of the frontal bone. So the name of these processes of the processes on the maxilla that extend upward are the frontal processes, shown here right between the eyes in green. The next process is a zygomatic process. We'll learn in a moment that the cheekbones on the side of your eyes here are the zygomatic bones. Therefore, part of the maxilla shown in green here that extends outward and laterally is the zygomatic process of the maxilla bone. The third process to notice on our anterior view is the alveolar process. The alveolar process is where the teeth will insert into the upper jaw or the maxilla. So recall that there was both an alveolar arch of the mandible and now an alveolar process of the maxilla. The fourth structure or landmark to point out on the maxilla here on the anterior view is an anterior nasal spine that would be shown right behind where this cursor is located. We'll see it better on a lateral view. But first, let's take an inferior view of the maxilla within the skull. The important thing to note here is that your hard palate that makes up part of the roof of your mouth is made of two bones. The anterior 75%, or the most of the front of the hard palate, comes from the maxilla bone. Specifically, part of the bony structure of the roof of your mouth, the front 75% of it, comes from the palatine process of the maxilla bone. The palatine process is what makes up part of your hard palate, or the roof of your mouth. Note that both the alveolar process, where the teeth insert, and the palatine process are located in the roof of your mouth. If you follow how I trace the cursor here, there's a little ridge where the alveolar process will join with the palatine process. This ridge is known as the alveolar ridge. And right behind your teeth in the front, you can feel this with the tip of your tongue, you can feel the alveolar ridge. That is an important point of articulation for speech sounds such as ta-ta-ta-ta-ta or da-da-da-da-da. Two other things to note on an inferior view of the maxilla, specifically for the palatine process, is how the hard palate is formed. Remember that the maxilla is a single facial bone. However, early on in development, this is pre-birth, so during gestation, the maxilla fuses together into this single bone. It fuses together along the midline at this intermaxillary suture shown here. The intermaxillary suture is directly at the midline of the hard palate. There's also a premaxillary suture that does not come through the midline and instead extends to the sides. I'm tracing the premaxillary suture with my cursor now. Why are these important to note? These are important for understanding cleft palate and cleft lip. In cleft palate, the bones of the hard palate do not properly fuse together during gestation, leaving a hole or a cleft within the hard palate along this intermaxillary suture, because these parts of the maxilla did not fuse together properly. In cleft lip, it's interesting to note that cleft lip does not occur in the center of the lip. Instead, cleft lip, if it's unilateral, will occur towards the side, right in front of where this premaxillary suture would occur, on one side or on the other side. Let's take two more looks at the maxilla bone here. On a lateral view of the maxilla, we can see that it is a large bone of the face. You can see the frontal process of maxilla bone again projecting upward. And note that there is the alveolar process where the teeth will insert onto the maxilla. We can also see a little more clearly now the anterior nasal spine shown right underneath the cursor here. Notice that there's a little outward projection. That is the anterior nasal spine. That's where some of the cartilage of your nose will attach. Let's also look at the mid-sagittal section of the maxilla bone, again shown in green here. What I'd like to point out here is again the alveolar process where the teeth will insert, the palatine process that makes up part of the roof of the mouth. Remember that this is only the anterior 75% of the hard palate, coming from maxilla bone. And I'd also like to point out the little ridge right here at the front of your mouth, behind your upper teeth. Feel this little ridge, the alveolar ridge, as we transition from alveolar process up into palatine process. The next of the facial bones is the palatine bone. The palatine bone provides the posterior 25% of the hard palate. It also gives the structure of the posterior nasal spine, depicted right here at the midline on this inferior view of the skull. The palatine bone is actually an L-shaped bone. It has both a vertical component that makes up part of the sides of the nasal cavity, and most important to us, it also has a horizontal portion. Specifically, the horizontal plate of the palatine bone is what provides the posterior 25% of the structure to our hard palate. Let's recap what we know then about the hard palate. The hard palate is made up of two bones, you will recall. The anterior 75% of the hard palate comes from the palatine process of maxilla bone, and the posterior 25% of the hard palate, shown here in blue, comes from the horizontal plate of the palatine bone. So we have both maxilla bone and palatine bone making up the hard palate. Recall that the little ridge behind the teeth is the alveolar ridge. Also recall that behind the bony structure of our hard palate is a soft palate. Notice the outline of the bone I can do here, the back of the palatine bone, posterior nasal spine right at the center. We can see that same outline of the bone here, looking at the roof of the mouth with tissue covering the bone. Posterior then to the bony structure of the hard palate, all of this soft tissue is the tissue of the soft palate. The soft palate is mostly made up of muscle and lymph tissue, and all the way at the back, posterior border of the soft palate, this little structure you see hanging down at the back of your throat is known as the uvula.